Thank you for joining us for our Mayor's Wellness Campaign webinar today, New Tools to Improve Community Health. I'm Julie DeSimone. I am the Program Officer of the Mayor's Wellness Campaign here at the New Jersey Healthcare Quality Institute. Before we get started, I just wanted to go over a couple of housekeeping items. The phone lines will be muted for the duration of the program just to limit our background noise. The webinar is being recorded and we will post it to our website after the presentation. We'll also be sending out a link to everyone who attended. And we really encourage you to ask questions by typing them into the chat box. We're going to be trying to answer the questions at the end, and we'll be passing those on to each panelist. So otherwise, we'll make sure we get to all of those. We have a great panel of speakers today. We have Dr. John Pepin, who is one of our Mayor's Wellness Campaign Senior Fellows. We have Shana Foster from Unite Us, and then we have Mayor Gregory Meyer and Rachel Giolito from Stafford Township. During the webinar, we're going to be defining the social determinants of health and how they impact your community, strategies communities can use to address food security and access to open, safe space, resources and tools to support residents in need of social supports, and how to utilize our two new Mayor's Wellness Campaign tools to enhance community initiatives. I'm now going to turn it over to our first speaker, Dr. John Pepin.
Good afternoon. Thanks for joining us today on this balmy Wednesday afternoon. Hope everybody's staying cool. I'm Dr. John Pepin, and I'm a general surgeon at Overlook Medical Center in Summit, New Jersey. And I've been a senior fellow with the New Jersey Healthcare Quality Institute going on 2 years now. So today I'm going to be talking about social determinants of health, namely what they are and what are some ways that we can improve them in our local community. But before I get to that, I wanted to share why I got involved with the New Jersey Healthcare Quality Institute in the first place and why I'm passionate about the need to improve social determinants. So as a surgeon, you tend to have one-off interactions with patients. They come in with an issue and hopefully the surgery fixes it. But 2 years ago, I was working as a medical director of a wound care clinic in Elizabeth, which is a very different experience from working in the hospital. There in the clinic, you see patients every week for chronic or long-lasting wounds. You do what you can to help provide treatment, but in the end, you're just really trying to help the body heal itself. One of the necessary conditions for this self-healing is ensuring that any other medical conditions are well taken care of. So my day-to-day work would be encouraging patients to make sure that they take their medications. I would call their primary care doctors to talk over their plan of care. You know, despite all of this, and despite patients' desires to get better, some patients' wounds were not healing. I kept on finding the reason behind this was that the patients weren't taking their medications. As the medical director, one of my responsibilities was to sit down with my nurse manager and discuss patients who seemed to be not improving. The nurses, of course, knew the patients better than I did. They spent more time with them and the patients were more relaxed around them. After my conversations with the nurse manager, I learned new things about the patients, like, for example, that a patient was currently homeless, or going through a divorce, or had lost their job. And it was these social factors that were impacting their health. It may have impacted their ability to obtain necessary medications, come to the clinic for care, or it may have been an additional mental burden. And I realized that working in this clinic underscored the important role that social factors play in health outcomes. So to start, let's define what these social determinants of health are. Typically, when we think of things that affect our health, we think of our family history, our genes, blood pressure, and other chronic diseases. And of course, those things affect our health. However, we also know that there are several factors from our environment that greatly impact our health and health outcomes. And these are called the social determinants of health. According to the World Health Organization, these social determinants are the conditions in which people are born, grow, live, work, and age. So this chart from the Kaiser Family Foundation shows the 5 major categories of social determinants of health. 1, economic stability. 2, neighborhood and physical environment. 3, education. 4, food. 5, community and social context. And 6, healthcare systems. Now, this whole list seems like a long list, and it is, but there are pros and cons to having a long list like this. The con is that it may paint the problem as too big to tackle. How can we hope to do all of this? The benefit is that because the list is so broad, the responsibility doesn't fall on one sector or organization. Collaboration is key to addressing these issues. Health systems, governments, community organizations, and residents can all work together to address social determinants of health. The other benefit of a list like this is that you can find specific actionable categories which municipal policy or even nonprofit work can have an impact. So the concept of social determinants of health can sometimes feel abstract because it utilizes such a wide lens. For more context, let's take a deeper dive into one of these categories and look at factors that affect the community's physical environment. This can include housing, walkability, safety, transportation, and recreational opportunities. This means looking at if there is housing available to residents that is safe and affordable. Can residents walk throughout the community? Is it safe to do so? And if not, is there affordable, reliable, and available transportation options? Are there ample recreational opportunities such as parks, playgrounds, and other public gathering spaces? All of these things need to be considered when looking at the overall health of a community. Each of the 5 categories walk us through different factors are affecting our health outcomes. So then the big question is, why are these determinants actually important? The first is their impact on health. Data from the World Health Organization suggests that these factors account for 30 to 55% of health outcomes, with estimates showing that the contribution of sectors outside of health to population health outcomes exceeds the contribution from the health sector. The other important reason is that these social factors are the primary drivers of health inequity. Health inequities are avoidable, unfair differences in population groups. Some examples of these differences are the differential life expectancy based on race. The most recent example was the COVID-19 pandemic, where people of color experienced higher mortality compared to white Americans. We have estimates suggesting that 70% of variation in health outcomes is a result of these social determinants. Now that we know what social determinants are and why they are important, the big question is, how can we impact them? Luckily, this topic has received a lot of attention through program implementation and research over the last decade. So we have many already existing strategies supported by data to pull from to implement locally in our communities, or expand upon the work we already have in progress. When I started working with the Mayor's Wellness Campaign, we researched what areas towns were looking for the most support in. Through focus groups in all 21 counties and feedback from all of you, our partners, members, and community leaders, MWC staff identified that one of the biggest needs was improving physical health and nutrition. While this has always been a focus of the Mayor's Wellness Campaign, the need was also increased due to the effects of the pandemic and the resultant social isolation. Mayor's Wellness Campaign partners throughout the state are already running important programs to address physical health and nutrition needs of residents. Now we want to challenge you to take the next step and incorporate social determinants of health into those programs. We're now going to take a deeper dive into our new tools that are designed to help you do this. This new series of tools that we will roll out will aim to provide a brief education on social determinants of health, offer strategies and programs you can run locally to address the issue, and show examples of communities throughout the state that are running similar programs. So as you can imagine, physical health and nutrition are two sort of enormous categories. If you think of nutrition, for example, does it include school breakfast? Does it include Meals on Wheels? Does it involve supermarkets and vending machines? The answer is yes, it involves all these things. So the easiest solution was to break these up into bite-sized categories, and that's what we did. So today, I'm going to talk about 2 of the categories that we focused on, namely food security and the effect of land use policy and physical activity. So one factor under the umbrella of social determinants of health that affects nutrition is food security. So we're going to talk a little bit about what food insecurity is, and then review the new Mayor's Wellness tool to help your local program address this issue. So food security is when every person in a household has consistent access to enough food to live an active, healthy life. According to the USDA, in 2019, 35.2 million people were food insecure, with a number that has nearly doubled since the pandemic. In New Jersey, 8.6% of residents, or 1 in 12, are food insecure. This disparity varies depending on where you live. 10% of children in New Jersey, or 1 in 10, are food insecure. There are also stark inequities in food insecurity. 14% of Black households, 18% of Latino households, they indicated that they sometimes or often did not have enough food to eat compared to 5% of white households. So we know that food insecurity is higher among low-income communities, Black and Hispanic households, households with children and single-parent homes, While risk factors for food insecurity include limited access to full service supermarkets, public transportation, and lack of affordable housing, a majority of people report not being able to afford food. And this is not just an isolated issue. Food insecurity in children increases the risk of being hospitalized and having poor general health. In adults, it's associated with increased rates of mental health problems, diabetes, hypertension, and being in poor or fair health. The new Mayor's Wellness Campaign tool lays out the steps you can take to address food security in your community. The first is to identify your community's nutrition needs. It is typically not necessary for you to complete your own community food needs assessment. The Quality Institute can connect you with local organizations or state agencies that regularly collect and share this information as part of a community health needs assessment. If a nutrition needs assessment has not been performed, consider collaborating with local community leaders to create one. The goal is to identify what your needs are and the reason why residents don't have enough food. For example, can residents get to the grocery store? Are there healthy options available? Or do residents have enough money to buy food? Knowing this will help you set your goals. Secondly, identify already existing initiatives and resources in your community. Many towns already have existing or nearby initiatives focused on improving residents' access to healthy foods. Consider how you can increase awareness of these programs. Your goal is to help connect and enroll your residents in these programs. Here are some ideas to help you get started. Reach out to community leaders and local organizations to identify what food security resources are already available. Be sure to also check Facebook and the internet. Ask how these programs are being promoted to residents to strategize new approaches. Connect with your local health system to learn more about their efforts to improve social determinants of health and what initiatives, if any, are focused on food security. Help connect the work they are doing with their efforts in your community so everyone is aware of all available resources and can work together to reach residents. Then you can create a food security program that fits your community if none exist, or if there are unmet nutrition needs you want to address. Start at step 1 to better understand your community's nutrition needs. This will help you design a program that addresses the specific barriers faced by your residents. Collaborate with community partners, healthcare providers, and health systems to develop and plan your new initiative and reach residents. There are great local examples of these types of interventions. Montclair's Mayor's Wellness Campaign is part of the Montclair Community Farm Coalition, which includes several community partners dedicated to tackling local food insecurity. The mobile food stands reach residents where they are, focusing particularly on those in senior housing and others in need of food access by subsidizing produce prices and accepting SNAP. The mobile food stand, which has 7 sites in Montclair and surrounding towns, served over 470 individuals, grew over 4,000 pounds of organic produce, and increased SNAP transactions while also engaging over 1,000 volunteers. In this new tool, you can find more details on all of this information we have covered, as well as specific actionable steps and additional resources on each topic. We never want our Mayor's Wellness Campaign partners to reinvent the wheel, and there are so many great resources already out there. We have included links to tools, resources for residents, and resources for municipalities and community partners to utilize. So now let's pivot a little bit to land use planning. Before we get to what land use planning is, let's briefly discuss about why physical activity is important. So regular physical activity protects against heart disease, type 2 diabetes, hypertension, depression, and certain types of cancer. As a result of these benefits, the CDC recommends 150 minutes of moderate intensity aerobic activity per week, in conjunction with 2 or more days of strength training. And when you hear aerobic activity, people have images of running marathons or doing triathlons. I don't do any of that stuff, but in reality, it includes things like brisk walking or even pushing a lawnmower. Despite these recommendations, only 50% of adults perform the necessary amount of physical activity to reap the benefits. The statistics are even more sobering in New Jersey, which ranks 37th in the US in physical activity. And when we're talking about the effects of social determinants and health disparities, we see it clearly here. Physical inactivity is more common in females, and those over the age of 65, individuals in low-income households, individuals with less than a high school education, as well as Hispanic, Black, and Native American populations. So there are tons of reasons why people do not exercise. Some may not have the time to do it. Some may not have access to opportunities for physical activity. Some may not just be motivated enough to do it or have physical impediments that inhibited them from doing it. One of the most cited reasons, though, is a lack of safe areas. The literature emphasizes the need to create opportunities for residents to engage in physical activity and make them aware of those opportunities by engaging in community-wide outreach programs. To that end, many of the best studied and most effective recommendations are to modify the built environment in order so that individuals can integrate physical activity into their daily lives. And this is where land use planning comes in. Land use planning is the process of determining how land will be developed and used. Typically, you may have heard about a land use plan when your city or town develops a master plan, which may happen every few years. The difficulty with changing built environments is the amount of time and collaboration to actually implement anything. But even small-scale improvements are helpful. Community stakeholders can consider things like improving sidewalk connectivity, increasing streetlights and bike lanes, painting new lines in the road to slow traffic, and improving access to green spaces. All of these activities have been associated with higher levels of walking, increased physical activity, and lower rates of obesity. These decisions help make communities healthier places to live, work, and play, and they also help our older residents stay in their communities. Many towns across the county, and like many of your communities, have adopted a health in all policies approach to improving health outcomes by incorporating health considerations into decision-making across sectors and policy areas. The goal is to consider how any decisions made may impact the health of a community and its residents. It is also imperative that you include a wide range of stakeholders in the process. Changes to the environment should involve several departments and teams, including planning, engineering, transportation, and/or environmental boards and committees. Other departments may also be impacted by changes made to your neighborhood environment, such as the municipal recreation director or senior services coordinator. In the new tool, you can find more details on all this information we have covered, as well as specific actionable steps and additional resources on each topic. So there are some concrete steps you can take to improve the development of land or land use policies in your community. Evaluate your current land use policies or development plans and consider the following. Did you reach out to community organizations, leaders, and residents? Is there buy-in from community members? Encouraging community members to participate in local planning meetings and develop meetings is a good place to start. Residents at times don't even know when the meetings are or if they're open to the public. Doing something as simple as advertising the meetings at Nextdoor or whatever social media choice you prefer is a good first step. Once your community is empowered to get involved, they can start advocating for things like walking trails or biking lanes and have a say in the master plan. Community organizations, on the other hand, provide important information about what is and what isn't working. Oftentimes, due to their work with others in the state or nationally, these organizations can contribute innovative ideas and strategies. So here are some examples of stakeholders to include throughout your planning and evaluation process. Residents and neighborhood associations, senior groups or those providing senior services, churches, local business owners, local nonprofits, local schools and colleges, police departments, and local hospital or healthcare providers. 2, did you discuss how this policy or plan will affect the health of your community? So many environmental factors can affect the health and wellness of your residents, such as walkability, water or air quality, and access to open space. Evaluate whether your land use policies or proposed development plans may cause unintended negative effects now or in the future, or if any changes can be made to improve the environment. For example, does your development plan remove any streetlights or sidewalks? Can they be added or improved? A smaller scale change such as adding in streetlights or connecting sidewalks can improve safety and encourage physical activity. 3, did you engage with other departments, committees, and/or state agencies? Changes to the environment should involve several different departments and teams, including planning, engineering, transportation, and/or environmental boards or committees. Other departments may also be impacted by changes made to your neighborhood environment, such as the municipal recreation director. State agencies and local universities can provide support, such as planning assistance, data, best practices, and grant funding. Consider establishing a formal collaborative relationship or coalition with all involved parties. Ask them to commit to including health considerations in all future planning decisions. Asking these questions and following these steps will help you to develop an action plan that is inclusive of all stakeholders and that fits the needs of your community. Once your community has considered the planning process, there are many evidence-based practices to choose from. Here are some examples of some structural changes listed in our toolkit, big and small, that have been shown to have a positive impact. enhance streetscapes with greater sidewalk coverage and walkway connectivity, temporarily close a street or part of a street to create space for physical activity or the community event, like a town fair, modify local environments to support physical activity, or increase access to new or existing facilities for physical activity by subsidizing costs. Educate and encourage community members to participate in local planning and development meetings. Create group walking audits in your community to help educate residents and raise awareness about how community design affects physical activity. Create welcoming design elements in parks like benches, areas for shade, and walking loops. And finally, you can use low-cost demonstrations such as pop-up retail shops, mini parks, and seasonal event spaces to get feedback from residents on innovative land use ideas. And finally, some of the larger scale improvements, if you're interested in, would involve promoting building housing with higher residential density and promoting mixed-use development. And that's all.
Great. Thank you so much, Dr. Pepin, for all that great information. And so now we are going to turn it over to Stafford Township to hear how they have used their experience with this process and walk us through some of the improvements they were able to make through their land use planning process.
All right. Thank you, Julie.
Thank
This is
you.
Greg Meyer, Stafford Township. Can you hear me?
Yes, you're all set. Thanks.
Fantastic. Okay, I'm Greg Meyer. I'm the mayor of Stafford Township, and I also have with me Rachel Giolito. She is the executive assistant as well as our HR director, among the many other things that she does. So we're both going to be handling this presentation today, and I hope you're going to feel much healthier by the end of it. So I don't know if you could see the slides that are up right now, but as we're going through these, I'll try to make this as interesting as possible.
Yes, everyone has access to the slides, so we're walking through those with you.
Perfect. Okay, so we're going to start on slide 14 right here. So what you see right here is at the top, you see a flooded roadway. Just below that, you see some storm sewer pipes. And what that is basically in Stafford Township, we had to pay a tremendous. I've been the mayor for 3.5 years now, and literally within a few months of getting in, we started getting some heavy rains and seeing flooding throughout the township in areas I hadn't seen before. And of course, it's a whole lot different being a typical resident as opposed to being the mayor or someone who works in public works or PD who has to deal with this thing all the time. But we did have a substantial rain event on July 6th of 2019. And I remember that day because we had within a 2-hour period, we had the highest amount of rainfall in the entire country. And it all happened to be right over the one part of town where we have the biggest drainage problems. So brought a lot of things right up to the surface very quickly. And so what you see here, these pipes are at the Neptune Basin, which is called. It's on Neptune Drive. It's at the bottom of it. It's a basin area that routinely floods. So see the one pipe to the left is very clear, where the other one, it's kind of like a clogged artery. It's almost halfway clogged up with sand and other debris. So we started doing, and you'll see down slide 15, you see our vac trucks going in there, cleaning out the storm drains, as well as increased street sweeping. Going down to slide 16, you actually see them, our public works guys in the holes. What happened there is there were some pipes which had collapsed over time. So they were older, I want to say iron pipes. Where in this case, the road had actually already been paved, and they didn't, the previous administration did not do any pipe inspection. So we hired a company to send in a drone, not a flying drone, but a wheel drone to go through every single storm pipe in town, figure out the condition of what all of them are. I'm trying not to jump around too much here, but where this is important is with drainage that has to do, since we are a Bayside community, there's a lot of that water goes right out into the bay where people swim, where people also other recreational activities, fishing, clamming, crabbing, things like that. So we've taken steps to replace the stormwater infrastructure, which involves adding in new drainage inlets up and down the streets, also cleaning out the pipes where we're able to. We also have plans to add a second drainage basin on the other side to prevent flooding. When that flooding occurs, there's actually increased EMS calls, people getting stuck, people having accidents, people driving into flooded areas with their cars floating around. So we've done quite a bit to improve the drainage infrastructure there. But what's also happened is there's a second portion of this. This is what you see here in slide 17. This is the Beach Haven West section of town. So this is the lagoon section. There's over 100 man-made lagoons, and I've been told this is the largest waterfront area in the entire state of New Jersey. And how that's significant to healthy towns is the fact that these were designed and built starting over 60 years ago. So going back into the 1950s, 1960s, the Shapiro brothers developed which what I believe used to be called salt meadows. It used to be something called a product, agricultural product called salt hay, which really isn't used too much anymore, but it was essentially a big grass area. And then they decided that they could dig into this and build a bunch of lagoons. Now, most of this was done prior to the creation of the Department of Environmental Protection, so you probably wouldn't see a project like this happen today. But that being said, when these sewers were put in the 50s, 60s, even into the 70s, they'd never been replaced up until 2019. When we got into the office, our water and sewer department mentioned to us that in phase one of this project, this is going to be about a 12 to 15 year or 15 phase project. For a lot of reasons. Primary one is cost, but we decided to tackle the worst part first, where you had the sewer department every day going in there, having to clear these pipes, move everything along, effectively move it uphill. So we did that first phase in 2019, finished up in 2020. Every year we're adding in a new phase to improve this sewer system. So what we've seen happen is over time, and I'm going to jump down here to slide 19. And if you haven't been fortunate enough to come to Stafford Township, we're also known as the gateway to Long Beach Island. So what you see here, that big barrier island, that is Long Beach Island there. And we are this little area over here in red, that's the lagoon community. And Stafford Township is actually 46 square miles approximately, which is a much larger land area. But in this area that we're talking about, you could see, and here I am on slide 20. So this is where you can see the effects of what we've done. So the sewer replacement was done over in this area along the bayfront. And this, if you can read down here, for shellfish with things like clams, it was a restricted area, meaning that you couldn't do any type of recreational or commercial shellfishing in there. The DEP found, using their own data, that it is called fecal coliform that's found in the water had substantially been reduced over a period of about 2 years. And you can see now this yellow means that it's conditionally approved, because the water conditions in that area had improved so much over time. And the only thing that we could attribute it to, the only major change, is the sewer line replacement that we had done in this area. So that's really tremendous to not just people swim in the bay and use it recreationally, but even if you go out to dinner, things like that. People, you talk about locally sourced products. So there's a lot of local clam farming that goes out in the bay. Oysters also come from the bay. Not so much in oysters, primarily clams, but whatever you eat that comes out of there, it's better. It makes people feel much better, and it is much better that you're coming from cleaner water. So that is a big plus and a big benefit to that project we've been doing, in addition to just the practical matters of having the sewers function properly. Down here, moving to slide 21. Sorry. You could see this is bathymetric data, or it's actually more visual data, where a bathymetric survey had been done throughout the lagoon and waterfront areas. We contracted a company also in 2019, ACTA Engineers, to do both a bathymetric survey that's measuring the depth of the water throughout these 100+ lagoons, in addition to all the other waterfront areas throughout Stafford Township. There's an issue where some people attribute it to Hurricane Sandy, but it's also just the age of the lagoons, where there's increased sedimentation. So they become shallower over time, and we're potentially looking at the possibility of dredging those lagoons. We've currently been approved by the DEP. We're waiting on the Army Corps permit. That's something that can help with the health of the entire area of this essentially man-made ecosystem. And it's also part of getting that process was checking the bottom composition as well. What is the base of lagoons made from? And it turns out we have very good material down there. It's the type of sand that they're looking for other types of projects, which can also help shore up some of these the tidal marshlands. So over time, the tidal marshlands, there's a serious problems with erosion, which not only takes away from the tidal marshlands, but also makes the bay shallower as time goes on. So if you can restore those area, it makes the whole area more resilient to storm surges, which certainly it benefits the people who live there, and certainly benefits the people in Long Beach Island and the fact that they might have to evacuate. Stormwater education. This is slide 2022. So we do a series of presentations, primarily with Save Barnegat Bay. They're a great organization that works on restoring the health of the bay, also with Rutgers University. So we did what's called a rain barrel workshop, and you can see it right in the middle. That right there is a rain barrel. And rain barrel is something that I think we've done 3 workshops so far, I believe, and we probably got over 100 people have made rain barrels that have gone out into the community. So that's a way of taking a resource right from your own roof. It rains everywhere, certainly New Jersey, and you could put one of these right at the bottom of your leader. Collect from your gutters to your leader going down into the rain barrel. You could collect rainwater that is essentially the freshest water source around, and you could use that to water your plants and also prevent, most importantly, when you're talking about ecological health, prevent runoff going into the stormwater sewer system, and of course into the bay from there. So you keep that water right in your yard, prevent it from going out into the street, out of the stormwater, and it really is just a great program. It also helps during times of drought when water levels are low. You have a nice 55-gallon water storage system right there, right on site, and it's something that you can use year round. You do have to essentially flip it over in the wintertime to keep it from freezing, but that's when you're not watering your plants anyway, so that's not an issue. You'll see here in slide 23, bioswale site analysis. So we're working with Rutgers to put bioswales throughout the township. There's one area. Rachel, do you remember what road that is on, where the bioswale's going?
I don't remember the exact location.
Okay, I know the area of town, but it probably wouldn't mean a whole lot to most of you are not from Stafford. But in any event, so you see right here, there's a lot of stagnant water. So that's something where mosquitoes are more likely to breed. By having bioswales, you get natural native plants growing there, which you'll see down here in slide 24. So this area, this is a parking lot, and this is actually called a rain garden, but it's very similar to a bioswale, which we'd be putting. It's essentially a larger rain garden. So it allows more water to be used on site, so that reduces the amount of stagnant water. It also, with the native plants, it allows pollinators to go in there, butterflies, bees, other insects and creatures like that will go in there and use it. And that is really important for the ecological health of the community and to the community as a whole, because mosquitoes, unless you're a bat, they really don't help anybody. We don't like to get bit, so we try to do what we can naturally to reduce their spread. And also, I think having rain gardens in parking lots, you see them in communities throughout New Jersey, but we are going to start seeing them in Stafford. We actually just had an application before the planning board a few months ago where they're going to be putting in a rain garden. So that's very helpful for keeping, again, that stormwater drainage on site and turning it into a positive. So you're actually creating a garden there, getting native plants growing. Now, the next part I'm going to turn over to Rachel. This is our Safe Routes to Schools program, and that's very important for the health of our students and also anybody who likes to walk throughout the township. Rachel?
Thank you, Mayor. Right, so when Mayor Meyer and his administration came on, they obviously had to tackle a lot of stormwater drainage and flooding issues. Another issue throughout the township was that the township is not walkable or bikeable. So Stafford Township partnered with the Stafford Township School District and the Greater Mercer TMA to develop 2 travel plans, one for our Ocean Acres Elementary School campus and one for our McKinley School campus. They're both located, well, Ocean Acres is located in a primarily residential area. We recently received a $992,000 grant to construct walkable and bikeable areas around the McKinley campus. offering safer travel options for our residents and our students. And we're also in the process of looking for grant funding to complete the same around our Ocean Acres Elementary School campus and the Ocean Acres community. Again, offering a healthier option for our residents to walk and bike our community as a whole. Next slide. And again, just reiterating the need of working with other partners. I know that Mayor Meyer mentioned Save Barnegat Bay. We've done a few rain barrel workshops with them. We've also worked with Rutgers to do some of our water testing. And I'm really just stressing the importance of working with other partners and developing those partnerships in order to work on projects and take actions and initiatives that will provide just a healthier lifestyle, healthier options, and a healthier, more resilient community as a whole. Mayor?
Yes. Okay. So, and that's like Rachel said, the safe routes to schools, it's kind of speaks for itself. If you have more sidewalks, it promotes a healthier lifestyle and also safety. If you do have to walk, you're not going along those narrow paths that you see worn into the grass, or even in many cases the shoulders of the road. So we're trying to make a more pedestrian and bike friendly community. And that is a tall order, but we're very happy that we got this grant, and we really want to thank Mercer TMA for their help with that. So with that, we have a new library that is going to be going in. That is hopefully groundbreaking. Will start in just a few months this fall. So we worked very hard for that. Got a nice grant from the state. And that is also ties into the safe routes to schools, particularly in that area. We made sure that the library is going to be putting in, or the county, I should say, will be putting in a sidewalk in front of that. And the new library is going to be right by the Southern Ocean Resource Center. It's on the same piece of property there. So it's really, not everybody thinks of a library as being part of a healthy community, but where else can you go to get so many resources from a trained staff for absolutely no additional cost to the taxpayer? So I really want to thank you for having us on for this presentation today. And I hope everybody got to learn a little bit more about what Stafford Township is doing to promote health within our community.
Thank you so much, Mayor and Rachel, for walking us through that. I think your presentation really shows us how some of these, larger scale projects, you spoke mostly about projects that I think we would consider to be in the realm of public works, but you really were able to show us how those types of projects and that type of health and all policy thinking really does affect the health and wellness of our community. So thank you guys so much for joining us for that.
Thank you, Julie.
All right. And so now we're going to shift gears a little bit. We are going to be turning it over to Shayna Foster from Unite Us. She's going to walk us through one of their tools and resources that can help you and your community better serve residents that are in need of supports.
That's right. Thank you so much. And thank you to the Healthcare Quality Institute and the Mayor's Wellness Campaign for having me on board today. My name is Shayna Foster, and I'm here with Unite Us. My background is in public health, and so I'm really interested in learning beside you all today. And I loved hearing those super actionable steps from you both, Dr. Pepin and Mayor Meyer. Next slide, please. I'm here today to introduce a new model of care that's driven by the community. And hopefully I'm here to offer some solutions to addressing those social determinants of health that you heard about a little bit earlier. Unite Us was founded by two veterans after their personal experiences transitioning out of the military. And they wanted to alleviate those issues that veterans and their families faced when transitioning back to civilian life. But they witnessed firsthand those complexities of navigating health and social care services just because of a fragmented delivery system and its impact on people's health. And so Unite Us was born, and we've since expanded to more than 44 states, and we serve really dense cities to rural populations currently. Unite Us is a technology company that builds coordinated care networks of health and social service providers. And with Unite Us, providers across sectors can send and receive secure, electronic referrals that track a person's total health journey. And we also allow you to report on tangible health outcomes across a full range of services in a centralized and cohesive collaborative ecosystem. So as of April 26th of this year, we were live in Bergen, Middlesex, and Monmouth counties. This is the number of organizations and programs and users that we currently have, but we're looking to expand, particularly at the end of this month. We'll be expanding to Essex, Hudson, Union, and Camden counties. And so we hope to partner with some of you all in those areas. Here's a glimpse into some of our partners. You can see, if you can really pinpoint some of these logos that we have folks on, from food pantries, from legal support, those organizations that provide health in a really accessible way. We have those organizations that help to prevent recidivism, and also just some opportunities for physical activity that you all spoke about being super important a little earlier on. And so we currently partner with all of those types of organizations, but we'd like to expand our partnerships with local government departments. And so I'd like to discuss a few reasons that local government leaders should partner with Unite Us. And the first is that we'd like for you all to be the agent for change and innovate the delivery of social care for your residents. Imagine a community member calling your office and telling you that they're in need of food for a family of 5. And you're able to log in to Unite Us and directly connect them with a service provider that can assist them. And that really takes that onus away from that person seeking help and places that in the hands of someone who can offer a response. We also would allow you to leverage some of that existing community assets to improve outcomes for all. And you're able to really easily search to see what's actually out there. And that would also kind of tell where we can improve and what we're kind of missing in our communities. We're able to help you all move beyond time-capsulated community needs assessments and really expand that to real-time data that's offered just by logging in and sending and receiving referrals. It's generated automatically. We'd also allow you to enhance community collaboration, just because we want to be able to connect those healthcare organizations with those social care organizations and local government organizations. And so we know that a lot of health happens in hospitals, a lot of health happens in doctors' offices, but there's that really critical piece of social care that we all need to tap more into. And so us having access to have all of these separate departments and organizations talk to each other electronically will really just make things a lot more seamless for those who are seeking the care. Next slide, please. Thank you. So there are a couple of examples that I'd like to share about some cities that have already adopted Unite Us. And so the first is the Mayor's Office of Criminal Justice in New York City, and also the Sacramento, California nonprofit Sacramento Covered. And they both work in partnership with the County Department of Adult Correctional Health. And they just want to make sure that they are connecting folks to the resources that they need so that they can reduce recidivism, because we know that those social factors like education and geographic environment all impact recidivism. And so those are just 2 examples of cities that have adopted Unite Us and are currently using it. I would just like to highlight that there are other ways that it can be used, from getting like those court systems to speak to like social workers at another organization, or social workers speaking to food pantries. So it's very customizable. These are just 2 examples of some cities that have adopted Unite Us. And so just by logging in, sending and receiving referrals, you would generate this really great data, and you'd be able to see who you've been able to serve, what exactly is missing. You'd be able to track your city or county's activity. You'd be able to measure your impact through data. And you're also able to use that data to help inform community reinvestment decisions. Are there a lot of food pantries, but not enough housing organizations? You're able to see that just by what you're able to send and what you're able to receive in Unite Us. And so we are on social media. You can follow us on LinkedIn and Facebook, Instagram, and Twitter. Again, my name is Shayna Foster, and you're able to reach out to me at that email listed. But next steps would be for you to schedule a workflow conversation where we can talk through really concrete steps about how it would look for your city to adopt Unite Us. And also, we would ask for some more information about the work that you're currently doing. And then we'd offer a software training for everyone that would be using the platform. And then we'd also like to hear who you'd like to partner with. Is there any organization that you're currently working with or that you would like to work with that you know of in your communities that could really benefit from a platform like this? Let us know. We're always happy to hear from you. So I'd like to jump into what it would look like really quickly if I can share my screen. What it would look like for anyone that's using Unite Us to go ahead and log in to the platform and to send a referral on a community member, a constituent's behalf. Alrighty, so when someone logs in to Unite Us at their own organization, this is my fake demo organization, and someone maybe calls your office and says that they are in need of help, you're able to enter that client's information into Unite Us, and it is HIPAA compliant, so only those who need to see that client's information will see it. And so we're able to find our client, enter their information, and then they will appear under your clients. You're able to add as much or as little information as that client or that constituent would like to provide. And you're able to see an overview of what exactly that client has received already. Are they coming to you after having been at a food pantry and a local housing organization? And you would be able to see a timeline of what's happened with that client, regardless of the department or regardless of the industry that they have been seeking help. And so if Kelly came to us, though, and said that they are in need of food, we're able to send a referral to a food organization that can help them and is already in the Unite Us system. So all you would have to do is search for food. A bunch of different categories of food will appear. We'll say that Kelly is in need of emergency food. And you're able to browse a map. Again, this is my fake organization, so this is not the live environment of who exactly is in Unite Us right now, but you're able to see all of those service providers that can provide that service right now and are willing to accept a referral for food. And so we're able to see what exactly these organizations do, a little bit more about them, and all of that is provided by the organization themselves. So this is all information that they've provided us, and they've agreed to receive referrals. And so you're able to add that referral to that client. You're able to tell that food pantry what exactly they need. We will need food. You can tell them as much or as little as you need or as much as you know. You're able to add any files that can help out the next organization. And once you save it, some more questions that are relevant to that referral will appear. You can answer as many or as few as you know. And then you're able to review that referral and send it off. Once you send it off, that generates data for your organization to use. You're able to send that client's information directly to that organization, and then it's that organization's responsibility to reach out to that client and provide the service that they're already providing on a daily basis. And so that is a very short demo of what it would look like for you to log in and send a referral using Unite Us. And so we really hope that you all would partner with us just so that we are able to reach more community members and serve them in ways that are helpful to them. And we hope that you all will join us. Thank you for your time. And I hope to collaborate soon. Thank you.
Great. Thank you so much for that, Shayna. I hope that everyone enjoyed that presentation and really sees how a resource like that can help your community to address some of these social determinants of health and issues that your residents might be experiencing. And so, you know, I just want to say we don't want this to be overwhelming. We covered a lot of topics today. And And it really speaks to the breadth of areas that social determinants can cover. And I hope that it gets you thinking about your mayor's wellness campaign and how you can start to think about some of these big picture issues and how they affect the residents that you serve. And so there's a lot of flexibility, not only in these topics that we cover, but in the tools that we are launching today to find something that works in your community. So I encourage you to reach out to us, Mayor's Wellness Campaign staff, and we're really here to help you as a resource to get started to further some of these efforts. So at this time, we're going to open it up for questions. So, type those into the chat box and we will get to as many as we can before the end of the webinar. Let's see. Okay, so one of the questions that we have here is how can I connect with my local health system to tackle social determinants of health? So I'm going to chime in on that from a mayor's wellness perspective. And then if any of our other panelists have some thoughts on that too, that would be great. So I think, our recommendation is always to contact us at the Quality Institute. That is one of the things that we really hope to do through our Mayor's Wellness Campaign programming is connect you to stakeholders, our members. We have connections to the large health systems in the states, your community partners, and we can really serve as a great resource to get those folks involved in your local efforts. If anybody else has anything they want to add to that, please feel free. All right, let's. Oh, go ahead.
One way that Unite Us is able to support that is by having local government organizations on Unite Us so that people are able to search. And when someone is searching for fitness classes or anything else that a city is providing, you're able to refer someone directly to that program and someone is able to reach out to that person and invite them directly. Great,
thank you. Okay, the next question is, and we're going to turn this over to Stafford. Can bioswales be used in places like Manville, New Jersey and Somerset County? That I don't know that Stafford would know the specifics on that, but maybe if you have a little bit more information on bioswales and how you decided to utilize that intervention. Either Mayor,
I think,
Mayor.
Julie, the bioswales, we're working with Rutgers on that, and basically what we've looked for are opportunities where there's land in areas that get a lot of stormwater. So if you can find an area where you can test, it's easy to test the water quality, it's a safe area, and it's in an area that floods. We have identified areas where that collection of water is easily done. If you like, Julie, I can bring something up on a slide with a map just to kind of show it if you'd like.
Sure. We can also connect, maybe Leslie, we can connect you with Matt so that you can get some more details on that if that works. Thanks, Matt. Matt is one of our other Stafford partners who's jumping in here. Appreciate that. Let's see. Okay, what advice would you give a small community that is looking to begin the land use planning process? So that's going to be for you guys at Stafford as well. You guys can probably speak to that.
So I think one of the things that we really did was when the mayor started in 2019, we identified those areas that were in desperate need. So we dealt with a lot of drainage issues and a lot of flooding. Part of what we did was we worked with the Office of Planning and Advocacy through the state of New Jersey to work on our plan endorsement. And we really utilized that process of plan endorsement to come up with the planning initiatives that we would need to guide us in those land use functions. And basically, there's so many vast ways. Since 19, we've developed a climate adaptation plan. We've developed a natural resource inventory. There's been a number of those planning initiatives that kind of tie back to how that land use gets used.
Great. Thank you. All right. I don't think I'm seeing any other questions. All right. If you do have questions after the fact, you can certainly contact me and we can get you connected with some of our speakers if they're the best people to answer that. I really want to thank all of our speakers for joining us today. I think that we covered a wide range of topics that I hope was useful to everyone. And remember that our Quality Institute staff is always here to support your Mayor's Wellness Campaign and the important work that you're doing in your community. We're available to speak to you and your partners and really look forward to continuing to work closely with you in the coming months. So thank you again to everyone who joined us today and to our speakers, and have a good afternoon.
There's one more question in
Oh.
the chat, by the way. Sorry.
Great. No, that's